Hi friends, it's so nice to see you today. Happy Wednesday, and we are having the 4th of July coming up soon, so I know all of you are super pumped and I hope you have a wonderful weekend. Today we're going to talk about a really important topic, and it is why do people go to chiropractors and what do they treat? Before we get started, I want to ask you a question. Or rather, I want to just say something that someone said, and I loved this. It was actually Tony Robbins. I heard him say this, and it really hit home for me. When you have your health, wait, I don't want to mess this up. When you have your health, there's only one goal that you can have. I'm sorry. When you have your health, you have many goals. But when you don't have your health, you have only one. I thought that was so interesting because it's so true. At the end of the day, the most important thing in our life is our health, because without it, we can't do anything. We can't have goals. We can't have, desires except just to be able to have our health again. And that's the intro to my talk today. So why do people go to chiropractors? I've heard so many times people say, when I've told them that I'm a chiropractor, oh, I'm so lucky. I've never had to go to a chiropractor. And because I've never had pain in my back. And I say to myself, whoa, chiropractor is so much more than treating back pain. So let me ask you a question. I'm going to use some visuals today, and this is one of my favorite pictures. This is the autonomic nervous system. So when a new patient comes to my office, yes, it's true, they usually come because they have pain, and it can be a child, it could be an old person, it can be an athlete. But most people start chiropractic because they have pain, unless they're really knowledgeable and they've done their research and they're determined to improve their health. So the thing with pain is usually the last thing that comes when you have a problem. Pain is a symptom. So when we treat pain, which is pretty much what our healthcare system does, they call it healthcare, but it's really sick care, is they numb the pain or they give you something to just take the pain away. But pain is actually a blessing. It's your body telling you there's a problem. How lucky are we? It's like taking a painkiller is like you're driving in your car and the light comes on, the engine light, and what do? You take a Post-it note or something and you cover that engine light and ignore it. So taking a painkiller is kind of like ignoring the problem, and the problem just keeps building up, but the indicator was the pain. And our bodies are so smart, and we are so blessed to have our bodies, and they do so much for us, and we couldn't, we have no idea how, hey Maxine, how brilliant our bodies are and how unlimited our health can be if we just listen to our bodies and take care of our bodies and correct what the cause of our problem is. And that's what chiropractic is all about, is correcting the cause of the problem. So usually when a person comes with pain, we try to, pinpoint where the pain is, figure out if it's a spinal problem, and then if it is one, then we recommend the correction, not just the pain relief. But, it's an option to just get pain relief, but it's not the optimal decision. And you will get pain relief for sure with chiropractic, and it will be natural, but it's not the best option. So here we have, the nervous system, the brain, and the spinal cord. And what I always do when a new patient comes is I say, what's the most important organ in your body? Well, most people say heart. Some people have said lungs. And the more, intuitive people say brain, because they're here at my office and they know the brain has something to do with it. But let's say you say heart, okay? I would say, well, yes, your heart's important, but what happens if this nerve to your heart gets blocked? Will your heart work better or worse? And most people say, worse. And I say, good one. And then I say, well, if that heart's been, has had a problem for a while, so basically the nerve to the heart is what allows the heart to beat. So let's say the heart hasn't been working for a while, and we unblock that nerve to the heart, and now the heart is starting to work better. But will it get better right away if that heart hasn't been working well for a while, or if that nerve's been blocked for a while? No, right? It's not going to get better right away because it's taken a lot of time for it to get sick because that nerve has been blocked for a while. So the bottom line is, if it took time for the body to get sick, it takes time for the body to heal. And that's a very important concept because we live in a society of instant gratification. We want it and we want it now. But really, everything takes time and everything takes patience. If you want to lose weight, you can't go on a diet one day and expect to have lost all this weight. You have to be consistent and stick with it. Same thing when you're working out at the gym. You don't go to the gym and get in shape after being in the gym for a week. No, you got to stick with it for a while, and then you have to maintain it. Once you build that muscle up and build your strength, and then if you stop working out, obviously you're going to stop losing your muscle, and then the same thing goes with any kind of a healthy regimen that you do, and the same goes for chiropractic. So I want to just go over some things about the body, how the body works, and what chiropractors treat, because we do treat pain for sure, but that's not really our goal, is not to just get rid of the pain. Hi, Alberto. How's Italy over there? But we want to improve the function of your body. So it's a holistic way to improve all the functions because the brain and the spinal cord make up the central nervous system, which is the master system of the body. Hi, Jimmy. It controls and coordinates literally every single function of your body. Your brain and your spinal cord is the master system. It controls and coordinates every single function of your body. I can't say it enough because people don't think about it and they don't realize it, but it's so true. So these nerves branch out from your spinal cord. They control all the organs, all the glands, all the muscles, and they come out of your spine. So that's what chiropractors focus on, is the spine, because the spine is what protects and houses your most precious part of your body, which is your central nervous system. How does the central nervous system connect to the rest of your body? Through these nerves, which are cut on this model, but you can see on this diagram, these nerves are like little strings, and they're millions of miles long, and they branch into smaller and smaller branches till they're like little hairs that give life to every single cell in your body. Hi, Stacy. The nerves in your neck go to your eyes, your ears, your nose, your mouth, your throat, your brain, your thyroid gland. They also go down your arms and into your hands. The nerves in your upper back go to your heart, your lungs, your upper digestive system, all these organs in your chest that are so important for your body to function. Your stomach, your liver, your pancreas, your gallbladder, everything is controlled by your nerves and your nervous system, which sit in your spine, which are housed in your spine, your delicate spine that moves all the time. And the nerves in your low back go to your reproductive system, your bladder, your bowels, but they also go down your legs and into your feet. So from the time we're born, we have so much stress on our body, on our spine rather. Even the birth process itself stresses the spine of a little baby. Can you imagine the birth process? If you're vaginally birthed, then that's at least a normal way for us to be birthed. But even if you're a cesarean birth, it's still so stressful to the baby and to that delicate spine and to the nerves. So there's three main causes, and we call it subluxation. That's what chiropractors treat. We're not treating your pain. So if a chiropractor says they treat your pain, that's really not true. we treat something called subluxation. That's a big word, and I want you guys to show off to your friends and family and say, I bet you don't know what subluxation is. I do, and it looks like this, subluxation. See that? So what that means is it's not a dislocation, because then it would be completely broken, but it's less than a dislocation. It's when the spine's slightly out of its normal alignment and it's putting pressure on those delicate nerves. So whatever that nerve goes to can no longer work properly. Okay? So you might have headaches, chronic headaches. You might have vision problems, hearing problems. You might have sinus problems. You might have chronic sore throats. You might have thyroid issues. All right? There's so many things that can go wrong. You could have numbness, tingling, weakness in your arms, in your fingers. You could have blood pressure problems. You could have heart problems. You could have breathing problems, asthma, things like that. And there's a good chance that your nervous system has a lot to do with that. And chiropractic adjustments have been known to help all these problems because we're going to the cause. So if you go to a chiropractor and you get a chiropractic consultation and evaluation, you get your spine checked and they find a subluxation in your spine, which is when your spine's out of alignment, blocking that nerve flow, even if it's just a little bit, then that means that that part of your body can improve your health when there's better nerve flow going to it. Picture a hose, like you're watering your plants, right? And then you bend the hose. Does more water come out or less? Less, right? And then you bend the hose and now the water's flowing. It kind of works that way with the nervous system. It's such a simple concept and it's such a profound change in your body when you have good nerve flow, when your spine is aligned properly. But I just want to let you guys know it does take time for the spine to heal. So you might start feeling better very quickly if you're going to a chiropractor. But the problem is chances are the spine's been out of alignment for a while and it needs to be re-educated and adjusted on a regular basis in the beginning to reduce that nerve stress and to re-educate how the ligaments, tendons, and muscles should hold the spine. And over time, your body will start to get the message and it will start to hold and you'll be able to go less and less frequently. But you're going to want to maintain some level of consistency, just like if you're going to the gym. You don't want to stop working out, or if you start doing any kind of healthy, like let's say you're on a healthy food plan and you lost all this weight and you're like, yay, I just lost 50 pounds. I'm going to go, eat whatever I want now. No, of course that wouldn't make any sense, right? It's the same idea with your spine, but your spine is so important. So there's 3 main causes of subluxation, and I'm going to try to make this really simple. The first cause is physical stress. And that's kind of obvious. What are some causes of physical stress? Well, just being born can be super stressful. And then learning how to walk and falling all the time, right? Everyone has that happen. Falling off the swings, falling off your bike, roughhousing with your siblings. All that stuff can stress your delicate spine up as a child. So that's the physical stress. Car accidents, lifting heavy things and pulling your back out. Sitting in a chair for hours. We're all doing that now during this COVID-19. We're stuck at home, or we were for so many hours, and our posture was getting so messed up and so uncomfortable, and the muscles were starting to go into spasm, and we're getting all twisted and out of shape. That's another cause of subluxation, when the spine's out of alignment and the nerves are getting stressed. Okay, so those are some typical signs of physical stress that causes subluxation. What's the second main cause of stress? You guys, if you know, I want you to put it in the comment box. All right? The second cause of subluxation is biochemical stress, or chemical stress. So our bodies, and I'm here in Bergen County, New Jersey, and I know Stacy used to live here. This is one of the most polluted areas in the world because we're right near Manhattan, but actually it's much better now because hardly anyone's in Manhattan now. But just walking outside, the air is so dirty, okay? The water is full of chemicals. We're using cleaners now like crazy in our homes and on our bodies, and those chemicals are stressful to our nervous system. So is the air stressful to our nervous system. The water is stressful to our nervous system. The pesticides that are on our food are so stressful to the nervous system. The chemicals, the genetically modified chemicals that they grow our foods with are so stressful to our nervous system. Anything that our body doesn't recognize becomes a toxin to our body, and it directly affects our nervous system. And guess what it causes? Right, subluxation, that new word you learn. It just causes stress, and it forces like the spine to get out of alignment for whatever reason. It's blocking that nerve flow, and it's stressing out your nervous system. So we got the biochemical stress, and don't forget the stuff we use in our home, all those cleaning products, the plastics that we use in our, water and our drinking things that are wrapped on our foods. It's really hard to get away from chemical stress, but we can put a lot of emphasis on eating as close to nature as possible, and also, cooking our own food, maybe growing our own organic garden, not using chemicals on our lawns, right? Trying to just cut out all pesticides on our lawns. All these little things start to build up and help our bodies and the earth and ultimately our planet, and we will improve our health that way. So the third main cause of subluxation is what kind of stress? Guys, we have it right now. Do you feel the stress? Emotional stress. When have you felt more stress? I don't know about you, but I'm this is really taking me down. All the stress of this COVID virus and how everything's being handled and the lack of human connection that we're feeling, the physical connection. So emotional stress is huge cause of subluxation, because what do we do when we're stressed? We tighten up, right? We squeeze our shoulder blades together. So a lot of people have stress in their neck because they're so squeezed, or they're in a hunched over posture because they're in fight or flight all the time, and they're they're all protecting themselves and stressed and feeling unloved and uncared for and unhappy. All that is affecting our spine and causing subluxation. So those are the three main factors that are causing subluxation to our bodies. And I'm going to show you another diagram that is going to be super interesting to you. So don't get off this video yet, because this is really interesting and something you probably did not know. So if you take a nerve and you cut that nerve, this is what a nerve function looks like. Okay? You cut a nerve. The nerve doesn't look like this, but there's three main functions of every nerve. All right? So 45% of the nerve function is affecting the motor part of the nerve. Motor means muscle. What can happen if the motor part of your nerve is affected? It's going to cause muscle stress, muscle weakness, muscle tightness, muscle spasm, and muscle fatigue. Those are the three possible things that are going to happen with those motor part of the nerve being affected. Does any of you guys have that? If you don't, I don't believe you. All right, so then we got the other 45% of the nervous system, and that's controlling the organs. Where is it? Organs, glands, and blood vessels. So we got the motor nerves causing, affecting the muscles, the autonomic nervous system part of the nerve controlling the blood vessels, glands, and organs. So you might have sinus problems or allergies. You might have ulcers. You might have exhaustion because your adrenal glands are so blown out from all the stress. You might have asthma or allergies or breathing problems because your lungs are being stressed, right? So you take the 45 and the 45, you put them together, what do you get? Come on, guys, put it in there. 90, right? 90% of your nerve system function is for muscles and organs. So what's left for pain? 10% of the function of your nervous system is pain. Does that mean it's the least important? No, it's definitely not. It's so important. That pain is such a gift because it's telling us there's something wrong so we can actually do something about it. But it's such a small part of the equation of how our nervous system functions. However, most people just care about the pain. But at the end of the day, I just want to let you know, you can literally have no pain and drop dead of a heart attack tomorrow. And how many people do you know that have had that? Oh, I saw my friend at the gym. He looked great. He felt great. He was working out so good. And then a week later, I heard he dropped dead of a freaking heart attack. So we can't judge our health on whether we have pain or not. So those people that say to me, I'm so lucky because I've never had pain, back pain, so I've never been to a chiropractor, I actually say to them, you know what, you're really not lucky. And maybe you should get checked anyway, because pain's a poor judge of whether you're healthy or not. So my suggestion to you, my friends, is to go to a chiropractor, get checked. It will literally change your life, but you have to be in it for the long run. And I don't know, how your chiropractors are, maybe in Italy over there, and how they practice. But I know with my patients, I tell them this is like a long-term process. It's not an event. It's a process, and you got to just be patient. Unless, you're super healthy and you just, when we look at your spine and everything's good and you just want to come for wellness, and yet maybe you only need to come once every month. And that's a really good way to prevent problems from happening if you're super healthy and your spine is in perfect condition. But otherwise, take the time, invest in your health, do something that's going to affect every single part of your body, every cell, every organ, every muscle, every gland, every tissue. Chiropractic is such a powerful modality. It will keep you strong and healthy, and it will give you peace of mind, because when you have health, anything is possible. You are unlimited. And it's such a gentle way to take care of yourself. It's completely natural. There's no, drugs. There's no surgeries. It's just gently aligning the spine so that the body can heal. Chiropractic is the largest holistic health profession in the world. It's also been around since 1895. So we're getting into our 125th year as a profession. Chiropractic was discovered in 1895. Not many, holistic things have been around that long. And you know what? We're getting more and more popular every day. So do yourself a favor. Do your body a favor. It's going to change your life. It helps you adapt to stress too. So just so you know, on the last piece, and I know this is a lot longer than I wanted it to be, but how does your body adapt to stress? Through your nervous system. That's exactly how it does. So, if you're a wild animal and you're running away from another animal that's trying to eat you, your sympathetic nervous system kicks in, your pupils dilate, all the blood rushes to your heart and to your extremities, and you're running away from the enemy or from the predator. And guess what's helping you do that, or allowing you to do that? Your nervous system. Your brain and your spinal cord and your nerves, that's what's allowing you to do that. And then you're done running away from the predator, and now you can finally stop and relax and lay down. And guess what part of your body kicks in? Your parasympathetic nervous system, the part that allows you to rest and repair, and all the blood goes to your organs, your inner organs, not your heart, your digestive system, and your lungs, and you're able to calm down. And that's such an important thing. But some people are locked in fight or flight or in sympathetic overdrive, and that means they blew a fuse, and they really need to go to a chiropractor and to get their nervous system more balanced so they can adapt to all the stress that's happening in their life. And there's always going to be stress. It's just part of life, right? It's not whether we can get away from the stress or not. It's whether we can adapt to the stress. And nothing I know helps you adapt to stress better than chiropractic. I see it every second in my office when people walk in, they're stressed out, and they leave, and they're literally like floating out of the office. They're like breathing. They're like, I don't know what I'd do without this. So you don't know what you do without this unless you actually started going. And I just want to let you know, if you're in this area, I am going to offer you a special deal today, because I really want to help more people. Instead of $150 for that first 1 full hour visit, and that includes the initial exam, adjustment, consultation, I'll give you $50 off. That's a really great deal. All right, I'm gonna take my time. I'm gonna tell you what you need. I'm going to do a thorough eval. You may not even need chiropractic, and I'll tell you that. But there's only way to find out if it's going to help you or not, and that's by going and getting checked. So thank you. Mention this video. Give me a call. Post beneath. Message me, and I will make sure to get you in either this week or next week. And thank you so much for listening. I hope I taught you something, and I wish you a wonderful 4th of July weekend and a great summer too. Love you. Bye. Bye, Maxine. Love you.